So if you see the other uses of rifampicin, one, as I have said you, it is used in the treatment of leprosy. Remember, this particular rifampicin is most effective and fastest acting drug in leprosy, right? So this is most effective and as well as the fastest acting drug in case of the leprosy. Next, it can also be used as a prophylactic drug for meningococcal and staphylococcal carrier states. So the other uses are, this is a prophylactic drug, right? So this is a prophylactic drug against staphylococcal and as well as meningococcal carrier state, right? Even against these two organisms, this rifampicin is acting as a prophylactic agent. Now, you take the adverse effects of this particular drug, right? Adverse effects of this drug. Remember, this rifampicin, it can cause light chain proteinuria and it may impair the antibody responses. Right? It may impair the antibody responses. Alright, next. The other point is, this rifampicin is also the hepatotoxic agent. Right? The other adverse effects are, this rifampicin is also a hepatotoxic agent, and this rifampicin may even cause the skin rash and as well as the flu-like syndrome and as well as the anemia, right? So this can also cause the skin rash, the flu-like syndrome, right? Apart from skin rash, the flu-like syndrome, and even it will also cause anemia, right? Even it will also cause anemia. Now, this particular flu-like syndrome is more prominent with the intermittent regimen. Right? This flu-like syndrome is more prominent with the intermittent regimen. Now, if you take this particular hepatotoxicity, the hepatotoxicity due to rifampicin is uncommon without pre-existing liver disease, right? So hepatotoxicity is uncommon without pre-existing liver disease. Now, another very important point is that because it is causing hepatotoxicity, it presents as hyperbilirubinemia without SGPT elevation. So what I want to tell you here is, it will cause hepatotoxicity. The bilirubin levels are raised, but the enzymes associated with the hepatotoxicity, they are not raised, right? So the presentation of this particular hepatotoxicity is hyperbilirubinemia. Alright, so the hepatotoxicity, it presents as hyperbilirubinemia without SGPT elevation. Alright, without SGPT elevation. Now, if you take this rifampicin, it is the inducer of drug metabolizing enzymes, right? This rifampicin, it is the inducer of right? It is the inducer of drug metabolizing enzymes. In the sense, this particular rifampicin, it will induce certain enzymes which are required for the drug metabolism. Now, because it is inducing the enzymes which is requiring for the metabolism of certain drugs, the metabolism of those drugs will be enhanced. Alright, the metabolism of those drugs will be enhanced. So remember, what are those drugs where the metabolism of those drugs will be enhanced, right? Rifampicin, it enhances the metabolism of the anticonvulsant drugs. It will also enhance the metabolism of the oral contraceptive pills, and it also enhances the metabolism of the oral anticoagulants, also enhances the metabolism of the antiretroviral drugs. Right, also enhances the metabolism of antiretroviral drugs. Now let me tell you the another derivative, that is rifabutin. Rifabutin, it has the little chances of drug interactions, but it is equally effective. Alright, but it is equally effective. Now a point that you should remember is this rifampicin is increasing the metabolism of the antiretroviral drugs. So rifampicin we cannot give in the HIV patients when the individual is on the antiretroviral drug. So in such case you have to give rifabutin. So rifabutin, right, rifabutin, it has little drug interactions. Right, it has little drug interactions, and because it is having little drug interactions, it is equally effective in the treatment of tuberculosis in HIV patients. So because it is having little drug interactions, so it is effective. So remember, rifabutin has little chances of drug interactions and it is equally effective, so used in the treatment of tuberculosis in HIV patients getting antiretroviral drugs. Now, because rifampicin is increasing the metabolism of the oral contraceptive pills, right? The females on oral contraceptive pills should either increase the dose of the pill or should use an alternative method of the contraception, right? So females should either increase the dose of the oral contraceptive pills or should use an alternative method, right, or should use an alternative method for contraception when the female is using rifampicin as a component of the anti-tubercular treatment. Next, the another important point is that you take another drug interaction, like example para-aminosalicylic acid. If you take the para-aminosalicylic acid will delay the absorption of rifampicin, right, will delay the absorption of rifampicin. Now because it delays the absorption of rifampicin, therefore concomitant administration should be avoided, right? So concomitant administration concomitant administration of rifampicin with para-aminosalicylic acid should be avoided. Next, coming to the oral anticoagulation, right? Coming to the oral anticoagulation. If you see this point here, rifampicin, it will also increase the metabolism of the oral anticoagulant, right? Rifampicin will also increase the metabolism of the oral anticoagulants like warfarin. Now when the patient is on warfarin therapy and about to start with rifampicin, remember he should be shifted to unfractionated heparin or low molecular weight heparin if rifampicin is being used for the treatment of tuberculosis. Alright, so patient on warfarin therapy. Right, patient on the warfarin therapy should be shifted to unfractionated heparin or should be shifted to low molecular weight heparin if rifampicin is used for the treatment of tuberculosis. So this is completely about your rifampicin. Let me shortly revise these points. If you take the other uses, remember it is most effective and the fastest acting agent for leprosy. And this is also the prophylactic drug. This is also used as a prophylactic drug for meningococcal and staphylococcal carrier states. And the adverse effects is that it can cause light chain proteinuria and may impair the antibody responses. And it is also the hepatotoxic and may cause the skin rash, the flu-like syndrome, and as well as anemia. And this flu-like syndrome is more common with the intermittent regimen. And this particular hepatotoxicity, it presents as hyperbilirubinemia without SGPT elevation. And this rifampicin is an inducer of drug metabolizing enzymes, and it enhances the metabolism of many drugs like anticonvulsants, the oral contraceptive pills, the antiretroviral drugs. Now, if you take the other derivative, that is rifabutin. Rifabutin has little chances of drug interactions and it is equally effective, and so it is used in the treatment of tuberculosis in AIDS patient. Next, you take in case of the females on the oral contraceptives should either increase the dose of the pill or use an alternative method of contraception when using rifampicin as a component of the anti-tubercular treatment. And you take the para-aminosalicylic acid. Para-aminosalicylic acid delays the absorption, therefore concomitant administration should be avoided. Next, the patient on warfarin therapy should be shifted to unfractionated heparin or low molecular weight heparin if rifampicin is being used for the treatment of tuberculosis.